Good morning. Thank you guys so much for joining us today. We're going to give folks just a couple more minutes to get logged on, and then we will get started with the webinar. Good morning, and thank you again for joining us today. My name is Nadine Long. I'm a program officer here at the Kansas Health Foundation. I'm being joined by Elisa Bueller, who is a grants officer here at the foundation, and Jeffrey Willett, who is our vice president for programs and policy. And we are here today to talk about the Kansas Health Foundation's latest RFP that's currently open, Tobacco Treatment and Recovery in Behavioral Health. So our plan is to spend a little bit of time going through the RFP and the application, the online application process. And then towards the end of the meeting, we will give you guys some time to ask questions and provide answers to those. We're going to be having the lines on mute up until that Q&A time, and at that point we'll open them up. So when we get to that portion of the webinar, if you want to go ahead and mute yourself so we don't hear anything you don't want us to hear, that would be great. If you want to hold on to your questions until that time, that would probably be the best. But if you're having any technical difficulties or there is something pressing you want us to know, go ahead and type it into that question box on the right-hand side of your screen, and it will show up on our end. Also want to let you know that this webinar is being recorded, and we will be posting it to the web page for this RFP at KHS website, and you should be seeing the link to that site right now on your screen as well. So with that, I'm going to hand it over to Mr. Willett, who's going to spend a little bit of time introducing the RFP, the Kansas Health Foundation, and why we are interested in this work.
Thanks, and good morning, everyone. Thanks for joining the call, and thanks for your interest in this funding opportunity. So I wanted to just briefly provide an overview of the Kansas Health Foundation and kind of explain why we're interested in this issue. The foundation is one of the largest health foundations in the state of Kansas. We were established through the sale of Wesley Hospital here in Wichita, and currently a public charity working to support a range of health issues. Over about a year and a half, our board engaged in a strategic planning process where we really looked closely at our focus areas, our grant initiatives, and did a lot of thinking about how we could best move forward to improve the health in the state of Kansas. And what you're seeing here is our strategic framework that emerged from that planning process. Through that process, our board established a vision that Kansas would have a culture in which every Kansan can make healthy choices where they live, work, and play. And we recognize that at this point, not every Kansan can make healthy choices that, based on where you're born, the resources you have, etc., your choices are sometimes limited. And to realize that vision, our board established two overarching program areas or goal areas. The first is health equity, and through that work, we are working to reduce health disparities related to social and economic factors. So we really look at health disparities and reducing or eliminating health disparities is driving our work in this program area. And We're really operating at 3 levels, or funding work in 3 levels. First, when people are sick or need medical care, we want to ensure that they have access to affordable quality health care. Second, we want to prevent especially illnesses related to tobacco use and overweight obesity, really to help address disparities related to both of those issues, tobacco use and and obesity. And third, we would like to address the social determinants of health. We know that, again, where you're born often has as great an impact on health outcomes as any behaviors or any healthcare access opportunities. So really working to address those social determinants of health. The project we're talking about today fits, I think, both with our prevention and our access to care interests. Our other program area is civic health, which is focused on engaging Kansans to improve the health of our state, and we support that work in the ways that you see there on the screen. So the purpose of this RFP is to fund organizations committed to improving health outcomes for individuals with a serious mental illness or substance use disorder by integrating tobacco dependence treatment and tobacco-free environments in the Kansas behavioral health system. We know that there are tremendous disparities related to tobacco use in our state and in the United States. There are very pronounced disparities based on income, for instance, where lower income Kansans are much more likely to use tobacco products than higher income Kansans. That pattern is the same for education. But income or education disparities pale in comparison when we look at tobacco use based on mental health or substance use, where this issue disproportionately affects individuals with a mental health diagnosis. I mean, to the extent that for some serious mental illnesses, 80% of individuals also use tobacco. So we also know that based on current tobacco use patterns, that individuals with mental illness consume nearly half of all the cigarettes sold in Kansas and the United States. And tobacco use contributes to the fact that people with serious and persistent mental illness die on average 25 years younger than the general population. Personally, I believe there have been tremendous advances in behavioral health, and those advances will realize their full potential when we also address tobacco use, when we address overweight, obesity, when we address those other factors that are related to chronic disease incidence for this population. So I think this is a tremendously important issue. It's tremendously important for the behavioral health system and generally for improving health in Kansas. This RFP that Nadine and Elise are going to be talking a bit more about here in a moment is the result of an extensive planning process that we participated in with a group of 22 stakeholders across the state. The Kansas Health Foundation has a leadership development program that we call our Fellows Program, and through that work we engaged 22 stakeholders that have expertise in public health and behavioral health. We have consumers of behavioral health services on that group, researchers, etc. And this RFP will fund several activities that group identified as being important to address this issue in Kansas. This RFP does not fund all of the recommendations of that group, but it does provide funding to support work related to several of those recommendations. So with that general background in mind, I'm going to turn it over to Nadine to talk more about the RFP.
Thanks, Jeff. Okay, so I'm just going to start by going over in a little bit more detail the activities that we are considering funding under this RFP. You probably noticed that we structured it through 2 tracks. One is focused on supporting behavioral health organizations in changing their culture and the culture of the broader behavioral health system around tobacco, as well as strengthening approaches to reduce tobacco use among individuals with a mental health diagnosis. So that can include things like establishing tobacco-free grounds integrating peer-to-peer programs, other best practices for tobacco dependence treatment, and piloting other policy and environmental changes that can contribute to a tobacco-free culture. Track 2, where we're looking at funding one specific agency to take the lead, is going to focus on advocacy with behavioral health insurance plans, providers, state government agencies, legislators, and any other individuals or organizations that could potentially influence the strength of treatment coverage or utilization within the Kansas behavioral health system. So that kind of covers the last two dots that you see on the slide in front of you right now. So those are the two tracks that we're looking at funding through. Let's talk a little bit about who should apply. We've already gotten a couple questions around this slide, and we just want to clarify that nonprofit organizations, state and local government programs are welcome to apply. We have a number of other folks that are listed specifically under this section in the RFP on page 3. But what we really want this RFP to focus on are stakeholders who can have an impact on this issue in the behavioral health system. So that can include more traditional stakeholders like community mental health centers and substance abuse treatment facilities, but it can also include agencies that are more focused on things like advocacy, which would fit under track 2. So hopefully that helps clarify a little bit who can apply under this RFP currently. So I wanted to highlight the available funding and the grant period. We would like to see up to $100,000 for a maximum award amount, but you are welcome to apply for less than that if the project doesn't require that amount. There's also a 36-month maximum grant term, and we're hoping to start May 1 of this year and wrapping up no later than April 30th of 2019. And just like you are welcome to request less than the dollar amount, you are also welcome to request a shorter grant term. We will consider a variety of terms within the initiative. And then we just wanted to let you know that we anticipate awarding up to $1.5 million through this RFP specifically. So another thing that I wanted to be sure to highlight is the meeting and reporting requirements that you'll find on page 5 of the RFP document. We wanted to make sure that folks within their budget include the travel and stay for at least one person from your organization to come to a 2-day meeting in Wichita per year. So if you're applying for a 3-year grant, budget to have 3 meetings here in Wichita within that time frame. And we would like at least one representative to come. Our hope is that with this work, and I'm trying to explain, the reason that we're doing that is we are trying to encourage or expand the potential of this initiative, hopefully beyond just those organizations who are funded. And we feel that one of the ways we can do that best is by kind of bringing these stakeholders together to network and strengthen that collaborative so that we can have a broader reach than just the organizations that are funded. And then in terms of meeting requirements, many of the initiatives that are funded under KHF are required to submit annual reports, but we'll also expect to receive quarterly updates on how progress is going related to the initiative, and specifically on the SMART objectives that should be submitted with your proposal. And I want to spend a little bit of time talking more about that specifically. We are asking that applicants provide between 5 and 10 SMART objectives, and on the RFP webpage there should be a document that goes into more detail about what a SMART objective is. So if you're not super familiar with objectives or what specifically a SMART objective is, please reference that document for some assistance. But we're looking for 5 to 10 of those. Excuse me, and SMART stands for specific, measurable, attainable, relevant, and time-bound. And we're asking that you all submit those on the proposal objectives template, which is the screenshot that you're seeing on the right-hand portion of the slide currently. So you'll document the objective and then the measurement tool that you're planning on using to gather and report that information. We provided one example objective just to kind of help folks think about things that they might want to measure and how it should be formatted. So go ahead and delete that example or leave it there when you submit it, whatever's easiest for you. And then do add as many lines as you need to accommodate the number of objectives that you're submitting. So, and we want folks to think about these measures as being important indicators of progress throughout the grant term. So it gives you, as the folks who are doing this really important work, a better handle on the progress that's being made, and hopefully and it'll give you an idea of improvements or changes that maybe need to be made if we're not hitting our goals like we'd like. It should also give us an idea of how you all are making progress. But then we also hope that these objectives will give us a sense at the end of the initiative of the impact, the broader impact that this work is having on the community. So we're looking for a number of things within those objectives, and hope that between the SMART document that's on the web page and the proposal objectives template, that'll help you put those together and submit them with your proposal. All right. We also just wanted to point out we do have, this is the grant agreement template that specifically asks for folks to outline any relationship that they may have with a tobacco company. And it's not an exclusion, but we just feel like because of the objectives of this RFP, we want to go in to any grant agreement knowing what those relationships are if you do have any with a tobacco company. So we just wanted to make sure to highlight that point. And then also highlight the sections of the proposal and how those are going to be scored. That table also includes page limits, so we hope that gives you guys an idea of how much information and we'll want to see within each of those sections. So these are pretty straightforward, but we've got, sorry, can you back up 1 second? Sorry about that. We've got just an executive summary that gives us a high-level look at the initiative, applicant capacity and experience, population and statement of need, and within that, please give us any data that you have on why you feel like this initiative is important and how it's going to have an impact on the population. We'll ask for your proposed project plan, the timeline, and evidence that supports why this is a smart investment for the foundation, and any evidence that this will have the intended impact. And then the objectives that we've already talked about, and a budget. All right, now I'm ready. Thank you. So also just wanted to highlight the timeline that's in the RFP. We've already obviously released it, and today is our webinar. So the next important date that you'll want to know is letters of intent are due on February 12th. And Elisa is going to talk a little bit more about how you submit those and the link that you'll get thereafter to submit the full proposal, which is due on March 7th. We are anticipating that grant awards will be announced the week of April 18th. And then, like we said earlier, we're hoping that projects will get kicked off May 1st. And then again, April 30th, 2019 is when we would wrap these projects up, no later than. And I will hand it over to Elisa, who's our in-house guru on how our online proposal process works.
Thank you, Nadine. So this slide here is just giving you a brief overview of the letter of intent and the questions that are going to be asked. Again, this is going to be due on February 12th, and they must be submitted by 5 p.m. Central Standard Time. After that time, the letter of intent will be taken down off our site, and I'll briefly go over how to access this link. But first, the letter of intent is going to ask you for the name and address of the organization that would be applying, the primary contact person's name, title, and their information. Also an identification of the track the applicant would be applying for, and just a brief description of the proposal. So what I'm going to do now is just go over how to access the link. So if you go to our home page for the Kansas Health Foundation, it's kansashealth.org. I'm going to go ahead and go to the home page real quick. As we scroll down this first page, underneath the grant and partnership opportunities, the first link there is to take you to the RFP page. So I'll go ahead and click on there. First, you'll just see a brief description of the initiative. Where it describes the webinar that you're attending today, that's where we'll provide the recording of this webinar as well as the PowerPoint slides. We also have the RFP document itself, and then the templates that Nadine talked about. So the proposal objectives template, the budget template, the conflict of interest template, and the SMART objectives description on how to write a SMART objective. We also have the grant agreement template. So once you've reviewed the terms of our grant agreement, we'll need you to fill out an acknowledgement of agreement review form stating that you would be accepting of those terms, and you'll submit that again with your application. But first, for the letter of intent, which is due next Friday, we have the link there to complete that. Once you fill out the online letter of intent and you select the submit button, you'll get an automatic email letting you know that we've received that letter of intent. And also it will provide you with the link to fill out the application, again, which is due on March 7th. And then we just give information on who to contact if you have any questions with that online process. So with that, we're going to open it up for questions. So I'm going to unmute every individual. So give me a quick second, and please make sure that there's no background noise. And if you need to unmute or even just mute your phone, please do so. So if you have any questions, we are ready.
Yeah, just first a request for everyone on the line to make sure your phone is muted unless you have a question. Otherwise, we're going to have too much background noise and we might have to mute everyone and ask you to text in questions. So please mute your lines, and if you have any questions, certainly unmute and ask. And I guess we're still in the process of opening up lines a little bit, so if we haven't, Elisa will let us know when everybody's opened up.
So while we wait for some more questions to come in via chat, I just want to back up a second and talk a little bit more about the activities that we discussed earlier, just to provide some additional clarification around that. So under track 1, we covered a lot of potential activities there, and I also just wanted to mention that we left that intentionally very broad because we wanted to give behavioral health organizations the flexibility to propose what they felt they needed to contribute to a tobacco-free behavioral health system. So if you don't see your specific activities that you're considering specifically listed, that does not preclude it. So please feel free to submit ideas that you have.
A question we had that just came in was, does the grant activities have to focus on consumers with SPMI or just consumers with a mental health or substance use diagnosis?
The proposal does not have to be focused on SPMI population. There's a section of the proposal narrative that allows you to identify the population and provide a statement of need for work related to that population. So in that section of the proposal, you will identify the population and basically substantiate the need for this work with that population in your proposal.
Another question is, can you talk more about the dollars available for medication to help stop smoking?
Sure. We do not, well, the primary purpose of this grant is to promote and support systems change that will be sustainable beyond the grant initiative. We recognize that having pharmacotherapy available to help individuals quit is important for implementing systems change. However, we also recognize that if we didn't put a limit on the amount of our funding that could go toward medication, we would likely see much of the dollars being requested for that purpose. So what we've done is we've limited individual grant awards so that only 10% of the awarded funds can be used to purchase FDA-approved smoking cessation medications to help you with the integration of tobacco dependence treatment into the health system. We are also funding that advocacy track, track 2, which would hopefully increase access to and coverage for smoking cessation benefits for the populations that we're talking about, for individuals who are receiving care through the behavioral health system. So our hope is that systems changes will be implemented. There'll be a lot of learning and sharing among the grantee organizations. There'll be a number of successes that we can build on going forward, and that the state will ultimately increase opportunities for providers to receive reimbursement for smoking cessation counseling and for the full range of FDA smoking cessation medications to be covered to the extent that they need to be to address smoking cessation for this population. So that was a long, rambly answer. The short answer is 10% of the grant award can be used for smoking cessation medications.
And another question we received, which Jeff, you likely answered, was, can you say more about the 2 tracks, specifically track 2?
Yeah, so track 2 is intended to fund advocacy work with health insurance plans, with the state of Kansas, with organizations that can influence the strength of smoking cessation coverage in Kansas. So we want to ensure that as many smoking cessation therapies are covered by health plans in Kansas, we want to ensure that clinicians who provide tobacco dependence treatment have a reimbursement rate that makes it reasonable that they will do this work. We want to see some exploration of how peer-to-peer programs and approaches could potentially be covered through health plans as well. So really, Track 2 is specific to working with decision makers to increase the access to and utilization of evidence-based smoking cessation approaches across the state of Kansas. Track 1 is specific to work within individual health systems, clinics, programs, etc. It's supporting work in individual settings to either integrate tobacco dependence treatment into existing existing approaches. So not to have a separate track for tobacco use, but to integrate tobacco dependence treatment into other programs and services, or to establish tobacco-free grounds and environments for those settings.
We're going to go back to one of the questions that was asked earlier and readdress that question. Can applicants blend objectives from the two tracks?
The answer is yes. However, our intention is to only fund one organization to do work related to Track 2, or yes, to Track 2. Mm-hmm. So it may honestly be, my recommendation would be, if you're interested in Track 2, to develop a very clear and compelling proposal specific to Track 2. Otherwise, we may it may get lost in if it's a blended approach. So
another question is, can you again clarify the grant amount? $100,000 for the life of the grant, or $100,000 annually up to 36 months?
$100,000 annually for up to 36 months. So if you're applying for a 3-year grant, it can be $100,000 for each of those 3 years, totaling $300,000.
There you go. You can get $300,000 for this RFP. That would be limited to 3 $100,000 annual payments. And now I think we've learned, look, we'll put $300,000. This is helpful. Sorry we haven't been clear in answering it, but the award amount is, yes, $300,000 total.
And if you have any questions after this webinar, you can submit them to Nadine, and her email address is on the screen.
Yep. We also didn't limit any time frame for questions, so up until the day before, if you have questions, please feel free to email me.
And we will post the Q's and A's as we get them on our website. If you go to the page for this RFP, there will be a link that has the Q's and A's that are submitted. So we will do our best to capture our responses to the questions asked today on that document, and then add others as they come in.
Yep. There's, on the right-hand side of that web page, there's a frequently asked questions document. It's already posted. We've only had one up to this point, but we'll add, like Jeff said, we'll add these after today and keep it moving on a rolling basis and reposting that. I want to give folks just a couple more minutes to submit any questions they have at this point. And while we wait just a little longer, I just want to say thank you all so much for tuning in to the webinar today. Do you tune in online? Well, whatever you do online. for listening in. We're really, really excited about this work, and we're looking forward to seeing the proposals that come in and the initiative that results from this work. So thank you, all of you, for all that you do for this population and the state.
Okay, we've received a couple other questions. Can academic medical centers apply, and can academic health centers apply?
Any nonprofit or government organization in the state of Kansas is eligible to apply for these funds. So any university would be eligible to apply for funding.
And then the slides
any state university in the state of Kansas is eligible to apply. Yep.
And then the slides from today's webinar, we'll get those posted as well as the recording of the webinar up there by the end of the week.
Yep. Okay, I think without further ado, we'll wrap up. Again, this webinar has been recorded and it will be available at the RFP webpage at kansashealth.org/tobacco recovery RFP, which is the link in front of you right now on your PowerPoint slide. So if you know someone who wanted to listen in but wasn't available, please feel free to point them in this direction, and they can view that at any point. We'll have the frequently asked questions document updated, and we'll get the slides up there as well. And one last time, any questions after this point, email me at nlong@khf.org. And thank you all again for being here.